People who fall in love have a high level of the hormone dopamine in their brains, which is responsible for their good mood. However, dopamine and its presence also affect the way we tolerate pain. Broken heart syndrome, also known as Takotsubo syndrome, is more common in women. According to research, 90% of the people affected by this syndrome are women. This may be because women tend to be more emotional, which increases their likelihood of being affected by this condition. Research shows that when people experience heartbreak, the connection between the brain's limbic system and other brain regions weakens. It appears that affected individuals have difficulty responding to stress and the emotional impact caused by heartbreak. Researchers believe that a specific part of the brain called the anterior cingulate gyrus responds to physical and emotional stress or pain. During broken heart syndrome, the heart becomes elongated in shape. This syndrome was first discovered in Japan in 1990, when some patients showed symptoms similar to a heart attack, even though there was no blockage in their heart arteries. Most affected individuals recover within a few days or weeks, but in some cases, this condition can be life-threatening and has resulted in deaths. Research indicates that many changes occur in the brain that can leave people mentally paralyzed. Because the brain is reacting very strongly to a particular stimulus. When people become absorbed in looking at old photos, they often do so by choice and even find comfort in it. However, if a person is unaware that this behavior can be harmful and continues to repeat it, they may intensify their pain, delay their recovery, and make the situation more complicated. Love is stored in the brain like a habit or addiction. So when you become used to someone and then experience a breakup, what happens to you is similar to what happens to someone who is quitting an addiction because the brain registers both experiences in the same way. For example, if you have a headache and take medicine but it continues for several days, you would naturally visit a doctor. Similarly, after heartbreak, you may need to seek help from a therapist and talk about it. Do not deny the sadness associated with it, and there is no need to panic or rush the healing process. Every day will be a new day. Do not worry, this time will also pass.